Hi, friends. We are going to talk about stress and how stress affects our body and mind. It's been like a long time. I haven't done any video due to personal commitments, but from today, I am expecting to do at least weekly once. Stress, how much ever I talk about it, never ends because it is very natural and universal phenomena that has both physiological and psychological components. Physiologically, stress is caused by the release of cortisol and other hormones, which leads to increased heart rate, blood pressure, and these again hormones it cause changes in the digestive and immune system as well. So, when I talk about the psychological, stress is caused by the perception of a threat that can be real or imagined. This produce feelings of fear, anxiety, and again that leads to change in the behavior, your problem solving, decision making. If it is short term, okay, but in the long term, the chronic stress can have serious health consequences such as depression, cardiovascular diseases, or it weakens your immunity as well. Stress can be very complex in terms of its psychological and physiological effects. At a physiological level, the body's stress response it is triggered by the release of hormones, as I mentioned, cortisol, adrenaline, and the neurotransmitters as well, dopamine. So these are released by your endocrine and nervous system, and which are meant to prepare the body to respond quickly to perceive threat. So here there is a very important role HPA axis it plays. It means hypothalamic pituitary adrenaline axis. So your body stress response it consists of three major components, that is hypothalamus, pituitary gland, and the adrenaline glands. When your body experiences any stress, the hypothalamus it releases CRH, that is corticotropin releasing hormone, and this again triggers adrenocorticotropic hormone ACTH we call from the pituitary gland. Then it releases this cortisol and adrenaline and hormones. So these hormones actually, cortisol and adrenaline, as I mentioned, these are responsible for the body's fight or flight response, where the body is mobilized to attack or flee from the perceived threat. There will be psychological changes under stress. This may be including fear, anxiety, irritability, difficulty in concentrating, and insomnia. So it is all very important to note that these psychological effects are caused by the body's physiological response to the stressor. In the body's stress response, it can be sometimes a small doses it will be beneficial, right? But if it is overexposure to the stress can be detrimental to both physical and mental health. Therefore, it is very important to understand how you are coping with the stress in order to maintain a healthy balance. So stress, I hope by now you understood it is a psychological phenomena experienced by all individuals regardless of age, gender, background. It is very natural and normal reaction to the situations that makes us feel overwhelmed and sometimes unable to cope up with the things as well. So stress can be triggered by both positive and negative events such as exams, job interviews, or death of a loved one. It can have detrimental effect, believe me, on physical and mental health, causing symptoms, headache, insomnia, depression, anxiety. To manage and reduce stress, it is very important to take regular breaks, engage in some physical and mental activity, and practice relaxation techniques such as deep breathing and mindfulness. And if still the problem persists, definitely approaching a clinical psychologist, taking some psychotherapy or some kind of help would be definitely help you. Thank you very much.